infertility, cancers, malformations. There's increasing evidence for effect on thyroid. I think that evidence is overwhelming. Obesity and metabolism and insulin and glucose homeostasis. Anybody in here been in practice for over like 15 years? Have you seen how many patients seem to have hormone problems now versus when you started practicing? Isn't it unbelievable? So your clinical observation is that, yes, there's something going on. Patients didn't used to have this many hormone-related problems. So xenoestrogens. So most of them are insecticides or pesticides. Also, red dye number 3, parabens found in many cosmetics, bisphenol A and phthalates. I'm sure some of you have heard of BPA and phthalates. Talk a little bit about BPA and phthalates. BPA was actually originally researched to be an estrogen replacement molecule in the 1930s. Does anybody know what actually superseded that? So when they got rid of BPA, they actually went to diethylstilbestrol, DES, was given to women to prevent miscarriages. There's 1,760,000,000 pounds of BPA produced in the United States every year. It's used in polycarbonate plastic and epoxy resins. You find it everywhere. Sunglasses, CD cases. Well, most CDs now are coming in paper. Water bottles.
That's 1 trillion. 1 billion.
Yeah.
Did you say million?
1,760,000,000 pounds. Yeah. Oh, I know. The inside lining of cans. I know that there are some companies out there now making BPA-free liners for cans. The Environmental Working Agency actually tests foods around the country every year for the BPA content within canned food. And if your food is stored in cans and it's got a BPA liner, there's BPA in your food. Phthalates. So what are phthalates? Phthalates are added to plastic to increase flexibility. You can smell phthalates. You know when you're around phthalates. There's 800 million pounds every year. They are known endocrine disruptors. 100% of us have them. They've been linked to kidney and brain damage, and they're also used as solvents in perfumes and nail polish and that sort of thing. So it was a study giving some Harvard kids some water bottles that had BPA in them and then testing their urine. 69% of them after 1 week had increased BPA levels in their urine. Found in 93% of the population on fat biopsy. The BPA has estrogenic activity, has been linked to liver damage, increased breast and prostate cancer, obesity and diabetes, and thyroid abnormalities. Anything with a 7 has BPA in it, not a lucky number. Phthalates, you can smell them. Anybody ever get a new shower curtain? Remember that smell? Also in rain gear, raincoats, rain boots, perfumes, nail polish, the new car smell, that's phthalates volatilizing off of the plastic in your car. Flooring, a lot of flooring has phthalates, and anything with a 3 has phthalates in it. So xenoestrogens in general, there is evidence linking them to testicular cancer, lower sperm mortality. So we're actually seeing infertility as a global epidemic now. Almost all countries are experiencing infertility problems in men. This is probably due to low sperm production, also low testosterone production. Obesity, endometriosis, and breast cancer. And breastcancerfund.org is a wonderful organization that disseminates and compiles information linking xenoestrogens and breast cancer risk and then what women can do. So it's a place you can send your patients to say, look, the evidence is overwhelming, it's extremely depressing, but here's what you can do is look at this website and get this stuff out of your life if you can. Have you heard this term obesogens? This new term? This is endocrine disrupting chemicals that actually lead to obesity. And the theory is the solution to pollution is dilution, right? So if these chemicals are everywhere, one of the ways to prevent the negative health consequences is sequester them by making lots of fat tissue. Prenatal exposure to xenoestrogens can lead to obesity in offspring by increasing the number of adipocytes, so the number of fat cells and the size of them, altering the metabolic set point and interfering with appetite and satiety, and also contributing to non-alcoholic fatty liver disease, which at least 25% of the population has. Everybody feels depressed to me now.
Yeah.
Sorry. But this is where you can help with this information. So a couple of movies that you might be interested in. The Plastic Paradise, which is about the Great Pacific Garbage Patch, which is an area in the Pacific Ocean that essentially is full of plastic. Most of it's little beads of plastic. Depends on what resource you look at, anywhere from the entire size of the United States to 2 sizes of the United States of plastic in our ocean right now. And then this is a great movie about the water bottle industry called Tapped. Okay, so why use hormones? Why use prescription hormones at all? Well, there's this concept of functional reserve. So what that refers to is the capacity of an organ or body part to fulfill its physiological activity, especially in the context of disease or aging. How much functional reserve do you have? I was just talking to my husband about this yesterday when we were running into Fred Meyer's for something. I said, you know, somebody was, there was a fight or something, or somebody had an argument when they were checking out, and we were kind of watching it, and I said, I don't have the energy anymore for conflict. It's like it takes too much energy. It's as if when we get older, we have this functional reserve and we know it intuitively, and we can't afford the energy it takes anymore for a lot of things. This is why people slow down, especially if they don't have adequate hormones. At some point, physiological reserve diminishes to a level incompatible with survival. That's dying of old age, right? The skin, the GI tract, and blood cells are constantly produced. You're always making new cells in those areas of the body, but muscle cells of the heart, and neurons rarely reproduce. And aging accelerates when hormone levels decline. So we are programmed for reproductive capacity. We are not programmed for longevity. And that comes from Dan Bittner's book, that statement. And he's a researcher who wrote a book published by National Geographic looking at blue zones in the world, areas of the world where people have extended longevity, especially compared to the United States. And really, that's what it comes down to, is we're here to reproduce and then sort of stop competing for resources. Okay, so hormone levels decline with age. This is known as menopause in women, andropause in men, adrenopause in women and men, so low DHEA. So menopause, growth hormone decline, and thyroid hormone. And really, and I apologize if there's any conventional medical doctors in the audience. I certainly don't mean to pick on conventional medicine, but one of the blessings of conventional medicine, and one of, unfortunately, what I think is the curses, is that it's really geared to prolongation of morbidity, right? Keeping people alive longer, not necessarily health care, disease management and disease maintenance. So that kind of is the model of conventional medicine, is treat disease with drugs or surgery. The drug industry in this country is a $791 billion a year industry, worldwide. $307 billion in this country alone. $307 billion in this country alone. The average number of prescriptions Medicare patients take, 28.5 a year. 11.5 use no drugs. More than a quarter use 6 or more drugs every single day. So oftentimes patients will say, well, how can I afford this kind of care? This is the cost of long-term care alone. So if you live long enough and you haven't prioritized your health, this is how much it costs to pay someone to take care of you right now. $7,300 a month for a private room in a nursing home. That's $240 per day. $6,400 for a semi-private room, so that's $200 per day, $210. $3,800 for an assisted living unit, that's $125 per day. $20 an hour for home health aid, which is probably a fairly low estimate for this part of the country because these are nationwide statistics. That's a lot of money for your kids to have to come up with, or somebody. And this isn't your health care. This is just long-term care. That's $45,000 to $87,000 a year. So the goal, in my opinion, of anti-aging medicine or longevity medicine is to extend the health span. After your mid-40s to mid-50s, you can see a significant decline overall in health. The goal is, how do we optimize health? Everybody's going to die and eventually fail, but how do we actually extend that health span? And bioidentical hormones can help not just with symptoms, but prevention of cognitive decline. So the biggest fears people have are, I don't want to have a heart attack or a stroke. I don't want to have dementia, or Alzheimer's, the most common type of dementia, and I don't want to get cancer. Well, hormones may be able to help not just with symptom relief, but prevention of chronic decline, protection of the heart and the blood vessels, promotion of healthy bones and joints, so preventing immobility, improving tissue repair, and optimizing immune function. So what are bioidentical hormones? That's a horse, because many of you probably know that Premarin, pregnant mare's urine, actually came from horses. Still comes from horses, keeping them pregnant. So what are bioidentical hormones? When I use that term, I'm referring to the same molecule as a hormone produced by the body. So it's not if it's made in a compounding pharmacy, or if it's the exact same hormone made by the body. So to me, some protomorphogens are actually not bioidentical. They're bioidentical to the animal that actually produced them. To me, bioidentical hormones should be supplemented in physiological dosages, so what the body could be making, and for the most part, they are safer than their synthetic counterparts. This is especially true for progesterone versus progestins and testosterone. I always like to separate facts from opinions so that I can provide information to patients and hopefully admit where I'm coming from. And here's a fact. There is a lot of research on bioidentical hormones. So if your patient's primary care doctor says there's no research, I have resources for you to supply that. One of them is my website, and we'll go over that at the end, because there's a huge body of research on bioidentical hormones. Bioidentical hormones absolutely carry risks, especially when given in excessive dosages. Overall, they have a lower risk than their synthetic counterparts, but we need to do more research on the long-term ramifications of bioidentical hormones. And our clinic is involved in some of that research, but we need more research. Opinions. It makes sense to test hormone levels before supplementing. Makes sense to do that. If levels are low or a person has symptoms, it makes sense to give them the hormone to bring them into physiological range. Bioidentical hormone requires a lot of expertise. You need to understand gynecology, urology, endocrinology, and then have experience. So really important not just to use testing to guide treatment, because testing is a moment in time, whether it's coming from the serum or you're collecting saliva or urine. And really what's important is to listen to the patient, because a patient's signs and symptoms can tell you a lot about what's going on in the tissues when it comes to hormones, rather than just doing a spot test. A little bit about breast cancer. Women have a 12% chance of developing breast cancer if they live to age 90. They have an 88% chance of not developing breast cancer. It's estimated this year that 231,840 women will be diagnosed with breast cancer, leading to almost 41,000 deaths. Too many women are dying of breast cancer. Breast cancer is actually the second leading cause of cancer deaths. Lung cancer is the first, and it may, to some extent, be preventable. So what are the risk factors for breast cancer? And we can group them as modifiable and non-modifiable. Non-modifiable risk factors are something you can't do anything about. It's the cards you were dealt. Being female, getting older, having a mother or a sister with breast cancer, or being BRCA positive, early menarche, so your first period, or late menopause, or if your mom used DES. Things you can do something about: obesity, lack of exercise, hormone replacement, especially synthetic progestins, especially unbalanced hormones, so not having adequate testosterone to restrain estrogen on breast tissue. Poor diet, so high animal and trans fats, low fiber, low vegetables and fruit intake, breast trauma, or late pregnancy or not breastfeeding. So some facts about hormones and breast cancer. Estrogens absolutely stimulate cell proliferation in breast tissue. Progesterone, synthetic progestins significantly increase breast cancer risk. I can't believe Provera is still on the market. Unopposed bioidentical estrogen replacement therapy does not increase breast cancer risk for up to 5 years, may increase the risk after. There is so much data on that, so I'll point you in the direction of where you can learn more. Bioidentical progesterone does not increase breast cancer risk, may decrease the risk. I don't think we can really say that yet. Synthetic progestins significantly increase the risk. Some studies using estradiol pellets showed no increased risk of breast cancer. Vaginal estrogens have never been shown to increase breast cancer risk. Testosterone appears to be breast protective. And there's actually a handout on my website called FAQ, Hormones and Breast Cancer, and you're welcome to download that or give it to your patients, and they can learn more that way too.
Is that pellets, the estradiol, is that bioidentical?
Yes, yes. So all the hormones that I'm going to be talking about today are bioidentical. I don't recommend or use any synthetic hormones. I don't even like birth control pills, but I don't treat that age bracket anymore. Every 50-year-old woman has a 2.8% chance. So this is data from the Women's Health Initiative, and it's good for you to understand the Women's Health Initiative because this is the study that changed the game when it came to hormone replacement for women. So this was a study that was stopped in 2002 because the IRB found an increased incidence in breast cancer in the women on Premarin and Provera. They actually continued the study for Premarin-only users. So they took the women out of the study who were on synthetic progestins, essentially. And this was the data from the arm that was treated with synthetic estrogen and synthetic progestin. So every 50-year-old woman has a 2.8% chance of developing breast cancer by age 60. So 2.8 women out of 100. The overall risk on Prempro, again, pregnant mare's urine with synthetic progestin, Provera, was 1.24. So that actually translates to less than 1 woman per 100 women is what that study found. Now, I'm not advocating Prempro. I think it's a horrible drug. It's just good to understand that. And certainly we care about that 1 extra woman in 100 if you're that woman or if someone you love is that woman. But that's the actual data from that study. The majority of breast cancer is found in women over age 50. Women have the lowest risk of breast cancer in their mid-20s when they're the youngest. And they have extremely high estrogen levels. They also are ovulating and making adequate progesterone, and they have high testosterone production at that time. So it appears that when hormones are balanced, it definitely decreases the risk. This was a study that we contributed to looking at testosterone pellet implants, and we'll talk a little bit about testosterone pellets and breast cancer incidence. And it was headed by a breast cancer surgeon in Ohio. It was 1,200 women looking at the long-term effects of testosterone pellets and breast cancer risk. The 5-year mark was published in Maturitas a few years ago. The study's still ongoing. At the 5-year mark, there was a 50% reduction in breast cancer incidence in the women who were on testosterone pellets. Actually, 75% in women on testosterone with Arimidex pellets. And this is similar to a study that was done in Australia. So other things to consider. Women are 10 times more likely to die of cardiovascular disease than breast cancer. Women are 10 times more likely to die of cardiovascular disease than breast cancer. Long-term problems associated with menopause, we've talked about all those symptoms. The 3 most common chronic diseases for aging women: cardiovascular disease, heart attacks and strokes, Alzheimer's and dementia, and osteoporosis. In fact, 20 to 30% of women have osteoporosis. A third of women over 50 will have a fracture, half of women over 60. Hip fractures risk is greater than breast, uterine, and ovarian cancer combined. In fact, a 50-year-old woman has the same risk of dying from complications of a hip fracture as she does breast cancer. Prostate cancer. It's nearly 100% survivable if caught early. Too many men, 186,000 a year, diagnosed with prostate cancer. Lifetime risk is 1 in 6. It's only a quarter of all cancer deaths. A quarter of all cancer diagnoses, 10% of cancer deaths. So the take home is that prostate cancer is very common, fortunately not very fatal. More than 2 million men alive in the US as of 2005 have a history of prostate cancer. The majority of men have localized disease, meaning contained within the prostate. Risk increases with aging, also with family history. And some things that can help lower prostate cancer risk that you can do. Tomatoes and lycopene, especially cooked tomatoes. It increases their lycopene. Vitamin D, vitamin E, and selenium, especially mixed tocopherols, not just plain vitamin E. This is actually a meta-analysis of sex hormones and prostate cancer risk, showing that serum concentrations of sex hormones were not associated with the risk of prostate cancer. Because one of the things you may still hear, although it seems like even the urological community doesn't link testosterone with prostate cancer anymore, but you might hear it. Anybody hear recently about the 2 studies that were published linking testosterone with increased risk of heart attacks? One was in JAMA and one was in PLOS ONE. So I wanted to put this information in here, and I have a whole handout on this on my website if you want more information. But one was an observational study. So observational meaning it wasn't an intervention study. Looking at 8,700 veterans who were undergoing angiograms. So these were men actually with symptoms undergoing angiograms, so they had cardiovascular disease, given a prescription of testosterone. And then they were never followed up. So we don't know if they filled it, we don't know if they used it, we don't know what their serum levels were, we don't know what their estrogen was, we don't know their other what they were eating or exercising, but some of these men did actually have an increased risk of heart attack. Another was an observational study that was published in PLOS One of 55,000 men showing an increased risk. An observational study of 25,000 men over the age of 60, no increased risk with testosterone. In fact, the men who were on testosterone, it was protective. So we already talked a lot about the associations between testosterone deficiency and problems. And of course, association is not causation, but it's very interesting. Low testosterone increases the risk for endothelial dysfunction and high blood pressure. Arterial thickness, so lower testosterone is associated with increased thickness of arteries, inflammation, poor lipids, insulin resistance, type 2 diabetes, obesity, increased incidence of MI and stroke in men with low testosterone, congestive heart failure, and death from all causes, including cardiovascular disease. And testosterone supplementation has been shown to improve high blood sugar, insulin resistance, high CRP, hypertension, lean body mass, chest pain, angina, exercise capacity, survival in type 2 diabetic men and men with congestive heart failure. Testosterone has been shown to improve their survival. Conflicting studies on cholesterol and inflammation. Okay. So these are the options. People say, what's available? Oral, controversial for estrogen. We could have a whole conversation about that, but never for testosterone. Sublingual, so through the buccal mucosa, hormones get absorbed very well, just like they get absorbed very well vaginally. Topical gels or creams, patches, especially estradiol for women, injections, and then pellets, which are hormones that are